it's a lot to just talk about innovation. In fact, I think operationalizing innovation sounds like a buzzword in and of itself, right? But help me with a better term here. I mean, what it really is in HSS, and I think everybody, including our patients, they want to know, does it work? Is this helping? This is making a difference? What's the evidence? And we're in several pilots right now, and the learnings to date in terms of how do you actually take a technology, but then with the wraparound service that is actually more important in this case, and work with each individual hospital to make sure the solution is customized to them. And so the steps that we take are obviously to start by assessing where is the hospital from an IT infrastructure, what are they in terms of their antimicrobial stewardship practices. It's going to be a CMS requirement that every hospital have an antimicrobial stewardship program in 2017. The Infectious Disease Society of America just updated their guidelines 2 weeks ago. Everyone's paying attention to this. The president has an advisory council that made comments. The WHO, the CDC, the attention is there. And so it's really now not why or when, it's how. And it's helping the hospitals to do this. So assessing their level of sophistication around stewardship is important, because then we'll compile all of their guidelines and their pathways and their order sets, and we'll take their formularies, we'll take their antibiograms, which tell us a little bit about what resistance problems they're having. We'll look at their hospital-acquired infection rates and any other pain points around, say, C. diff infection. We'll analyze their workflows, understand how their nurses and their physicians and their pharmacists work together, where data should go, when they're using the EMR. And then we customize these rule sets to their hospital so that, for instance, one hospital wants everybody to get an alert when a piece of data becomes available. That's fine, we can do that. Or no, we just want it to go to a clinician. Or no, we actually want to delegate because we don't want to overwhelm clinicians with alert fatigue. They're already overwhelmed as it is. Let's send it to the nursing staff first or the unit manager, and then there's an escalation process from there. So that workflow customization is critical in each of these sites that we've been. Once the technology is live, obviously there's an ongoing maintenance service that we provide. It's ongoing curation of the rules that are running this. It's ongoing knowledge transfer, adding best practices to this. Certainly if there's there's an antibiotic shortage, well, we can quickly turn off or change certain rule sets around that. And then as with any service, there's a continuous process improvement. It's iterative, it's thoughtful, it's methodical. We take the information, as I said, we feed it back to each health system so that they can provide that insight. Because the goal, again, is to improve patient care by decreasing prescriber variability and improving and optimizing antimicrobial use. So in terms of the success factors, I think I've mentioned some of here before. It's not just a neat and new technology. The key is the wraparound service that comes along with it so that the system can be, or the solution can be customized to the customer's needs. And so it's that building to the customer, which we know is important. But it still has to be a scalable technology, and it really needs to include all clinical data. Just using one part of the EMR, which is sometimes less than 50% of the relevant data, is not going to provide the solution that's going to have the broadest impact. And part of this, too, is the IT resources in hospitals are really overburdened already. We know that they're doing lots of integrations. They've got queues that are hundreds of priorities listed. So it's making sure that it's a light touch with our integration and that we're doing a lot of the work of maintenance for them.